Hi, this is Dr. Jen Anaker with Anaker Clinics of Chiropractic. We are excited tonight. We have a great guest for you. We have Dr. Chelsea Beyes. She is a physical therapist that specializes in pelvic health. And so we are going to ask her a few questions and get some insight on her business and also on what she specializes. So Dr. Beyes, if you will, for us, just give us a little definition of who you are and what your business is, and then we'll dive in from there.
Yeah, so I am a pelvic health physical therapist, and I've been practicing pelvic health now for about 8 years. It's such a specialty in that it really specializes into pregnancy, postpartum, but also into bowel bladder function, sexual function, even into the GI, and with all of that, then you have to think about the orthopedic components that kind of play into those functions too.
Sure.
So, yeah.
So if you can tell us a little bit about, we'll dive into the pregnancy specific. How does the services you provide, how do they help out a pregnant mom, and then maybe we'll go into postpartum care?
Sure. So for pregnancy, obviously there's a lot of changes that occur. The obvious one being the abdomen, and then also the breast size, and then the posture changes inevitably. With that, with the stretch of the abdomen, there's a lot of undue stress that occurs with it. So if you can keep those muscles active and toned, then there's better support and function. So then pregnancy can continue a little bit more comfortably. It's always easier to put out a campfire than it is a wildfire. So the problem and the difficult part with pregnancy is that the pain can evolve slowly, and then suddenly it's out of control. So trying to get a rein on it before it gets too out of control so that it's a little bit more comfortable by the late pregnancy phase. So then fast forward to postpartum. I mean, obviously if it's a vaginal delivery, there's more stress that has occurred. A lot of people have the misconception that just because it's a cesarean section, that they get the quote easy way out, and it's not. It's a major abdominal surgery, so those muscles are then inhibited by the surgery itself, which can then perpetuate to weakness. But also the pelvic floor is weakened through the course of the pregnancy by the prolonged stress that it takes on by carrying the load of the baby and the increased weight and everything. So weakness inevitably occurs there too. So then fast forward to postpartum, then you have just a sense of overall weakness, more aches and pains that maybe perpetuate from pregnancy and persist and don't ease up. Or sometimes that maybe new aches and pains can present after, because having those weakened muscles and then now having to carry around a little bundle of joy, who of course is very calm and easy to take care of, and isn't much work. And having to lift and move and manage different things that suddenly your body is just supposed to rebound and take care of. So it needs a little bit of TLC, a little bit of rehab.
Now I know too, obviously there's, certain, like you described, there's certain, symptoms or, obviously the physiological changes that are going on. But I know too, I don't know if you have any comments about it, that like in France, for example, I want to say it's every woman, but we'll, pretty much where it's a part of the process of taking care of mom and of the female. So I'm sure in comparison, if you have any thoughts for the audience tonight about what we see in the United States versus, how that could benefit, I should say it that way, how that could benefit moms.
Yeah, I don't have the exact statistics, but offhand, the countries that do utilize that postpartum rehab for their moms, even without having any symptoms, just standard practice, they're going to have better long-term pelvic health as well as orthopedic health for their bodies. The muscles just restore that function a little bit better. So thinking, then the moms can play with their kids a little bit more freely. They can chase after them in the park and not have to worry about leakage.
Sure.
They can jump on a trampoline without any problems. Or
quality of life.
Quality of life is the big
Absolutely.
part. Then fast forward further on into like menopause, when as we age, our muscle fibers decrease in quality and quantity, and so incontinence becomes more prevalent. But if they're aware of what to do earlier on, those problems are going to be not mitigated, but at least delayed.
Sure.
And at least much more easily managed
Yeah.
when they do occur, if they occur.
Awesome. So as you can see, Dr. Beyers is very, very knowledgeable, and we are super excited that this next Wednesday at our office, we'll have the link down below that you'll see more, more information. But we're super excited to have her expand her knowledge to share with our community and the Treasure Valley community. We're hosting in our office, in our Meridian office. Again, everything will be in the link. And I'll just say in closing, Dr. Chelsea, if you can just tell us, some of your phone number, how to reach you, and we would like you to RSVP. That's listed on there. And then just also letting the audience know about your mobile service.
Sure. So I offer both an in-home practice as well as a clinical practice. So really whatever's easiest for the moms, trying to eliminate any barriers to attending care. But they can find more information on my website. It's www.tv for Treasure Valley, pelvichealth.com. And then the phone number is 208-991-4526. Or they can email me and RSVP at chelsea@tvpelvichealth.com.
Awesome.
Yeah.
Dr. Chelsea, thank you so much. And we're super excited for next Wednesday in our Meridian office. RSVP, and we'd love to have you at our office. Thanks again.
Of course.